Yeah. And so, what inspired your organization to become more inclusive and responsive of survivors who use substances?
Oh, I have to say, honestly, it wasn't a voluntary choice. We just realized that a lot of the survivors that we were seeing were using substances and were afraid to disclose that, afraid to ask us for assistance related to that, afraid to tell us on crisis line that, hey, I'm going to need to be going to the methadone clinic or whatever. And so we said, all right, what is it about our services that is making survivors afraid to disclose? And what can we do to better support them in, first of all, acknowledge that we know the use of substances is common among survivors. And so we just acknowledging that, but then also saying, what can we put into place to help support people wherever they are on their journey with regard to using substances and being victims of domestic and sexual violence?
Yes. So, really being aware and open to the reality that
Right,
survivors face,
right.
and then also being just empathetic and really listening to survivors and the fear that they were
Mhm,
experiencing.
mhm,
And there's so much that we don't have control over. There's so much fear in the experience of victimization, anyways,
mhm.
that then to really find any part of our services that is kind of recreating that situation and to address it.
Exactly, exactly. In the best way that we can, in the best way that we know how, we realize that we didn't have adequate knowledge, training, or resources around that. So really trying to seek it out and do things in a very intentional way.
Yeah. And I hear there all the reflective practice and all the intentionality around it. That it's not something that you just kind of like, trip and fall into, but that it takes intention.
It absolutely does. It absolutely does. Because when you start focusing on the individual needs of survivors, it can take you into some really unexpected places. Things that you never thought you'd see your program doing or providing. It really it's kind of amazing in a way when you're able to provide those services, but then it's also disheartening to see how big the need is and how it's impossible for our agency to meet the needs, all of the needs. So it's kind of like, wow, I did not realize how big this need was. And we've got to really engage our community in doing something to help us work on this.
Yes. And there's so much stigma
Mhm.
around domestic violence, sexual violence, substance use, mental health, all of these experiences. And then that stigma is so damaging. And one of the ways that it's damaging is that it really covers up the depth of the need. And people think that it's just this kind of like side thing or this thing over there, and not recognizing how present it is through our communities.
And how much we are really going to have to come up with long-term care solutions for survivors that address all of these needs. With us being primarily a crisis response agency, having to realize that there are limits to what we can do, but what we really need to do is advocate in the community for long-term care responses for survivors with these needs.
Yes.